be my question because when my aunt was diagnosed, and it took a long time to get that diagnosis. That was one of the things, we didn't know what was going on. And when she was diagnosed, we didn't know where to turn in terms of looking for support. The truth is, we didn't even know we needed support. And so knowing that your organization is there to provide that support is very important. And we got a lot of different misdiagnoses to the point where we were told that the medication was going to slow down the progression. So we got a lot of misinformation. And so the importance of having a place for families to go and not only get information, but get that kind of emotional support that
and the
need.
respite care too. I mean, it's an ongoing 24/7 type of
It's
job
very
and caretaking. And, you know, sometimes in the later stages, they don't sleep. Patients don't sleep at night. They're up 24/7. They wander. There's safety issues.
Or I guess it gets expensive too, because if you do end up ultimately having to put someone in an institution, then you've got to find a way to pay for some of this. Am I correct?
And that's a difficult decision because with my mother had dementia, Alzheimer's, and she was really at the stage where she was a young girl back in Cuba, and she didn't recognize any of her children, but she kept talking about, oh, my parents were here. So, how do you deal with someone that is so back into the past, and that's where they are, and they don't know who you are, but they know you're a relative, but they can't really answer you, or they're not.
It's like
present.
you've lost the parent
It's
before
like
the
I've
parent
lost,
is gone.
Exactly, and
Right.
that is.
I guess
very
that's hard.
painful.
That must
It's
be very, very
painful
hard,
because
yeah.
it's
Because on a
negating
rational
your
level,
existence.
You're mourning the
on a
living.
rational level, you think, well,
mourning the
but
loss.
but it's still there, yeah.
And she's very much alive, and but the personality is different. Her responses, her reaction, that was like seeing a person literally change in front of your very eyes, and it got worse and worse each time.
Earlier, a beautiful point was made, Tony, in the previous show about being in the moment with the individual, the family member, and I think there's something to be said about being in that moment. So she was her in the moment of time of a 17-year-old back in Cuba, and so you're seeing that identity and regression, but it's still that person. It's not the mom that you got to know, or the grandmother, or but it is the person that was still there, and it's really, I think, harder for the family accepting that loss again while living, but embracing that regression in the sense of a historical aspect of going back in their lives, and not a disconnect completely, but living those earlier moments and memories.
Right, but there's probably a sadness, because I remember when my father came out of anesthesia, and he was saying all kinds of things. And I said, gee whiz, if he stays in this state, he's not dad anymore.
Right.
And there is, so there is the coping. Now, what I also read was that this disease is more prevalent in the African American community. Talk to us a little bit about why that is, because of health care? Or lack of, or
so one, I do want to just touch on what we were talking about, which is the challenge of families to deal with this emotion, but also learning. And so a lot of what we do with families is manage their expectations, make sure that they understand that many of the behaviors that they're going to see, that's the disease. The person really doesn't have any control over the way they're acting or what they say to you. And so if they cuss you out, understand that that's the disease. Enter into the person with their current reality.
Right.
We can't go back in time. They are who they are in this moment in time, so go with it. And so a lot of the training and the education we do is about that. And then also providing support to people, giving them the opportunity to talk to their peers who can talk about, well, I lost patience and I yelled and I didn't really want to, but I feel bad about it. Or other people who understand their struggle. So that's really important to create the space for that to happen. But to your question, which is in African Americans, why do we have this increased risk? So African Americans are diagnosed at 2 times the rate, and we are also diagnosed later. many times because we're not recognizing the warning signs. So part of that reason may be that there's a genetic component that explains the increased risk of African Americans, but we don't think that that's the only reason. So it's probably also due to the fact that African Americans have higher rates of diabetes and high blood pressure. That also might be increasing our risk. But again, that's another area of research that not only the federal government is looking into, but also the Alzheimer's Association.
Wait a minute, what if you're on medication for diabetes or for high blood pressure? Would that not mitigate the risks with that? So with that, I'm assuming they're taking the medication on a daily basis.
Right, so there is information and evidence to suggest that might be mitigating, but again, it's still a fruitful area of research to see, let's say, if you had very tight blood glucose control, could that mitigate your risk?
Right.
That's actually a current area of research that the Alzheimer's Association is doing in terms of a study called the US Pointer Study, and it's looking at people at increased risk of developing Alzheimer's disease and seeing if you give them a healthy diet, exercise, treat whatever conditions they may have, and make sure that the person is mentally engaged, if we can decrease the number of people who go on to develop Alzheimer's disease. So we're hoping that in a few years, we'll have some more information to give to people in terms of, what is the actual recipe that you can take to
prevent
Alzheimer's
halt.
disease.
What is the best kind of doctor to see to manage this? Is it an internist? Is it a primary care doc? Is it a doctor that specializes in geriatrics? I mean, what would be the...
So it very much depends on where you are, but I'll give you a New York City answer. In New York City, we're blessed with many neurologists, so that's a good first step in terms of managing the diagnosis process. In addition, there's other people who could be part of the team as well, like a geriatrician, a psychologist, a psychiatrist. But I also, those are important parts of the team. I also suggest that people have a very good primary care physician because many times it's very challenging for families to understand what these different doctors and the team may be saying. So you really need a primary care doctor who's in your corner, who can be your interpreter so that you can navigate the health system.
One of the things that a girlfriend told me recently, she said the blessing of having a mate is that as we get older, we need to take charge by observing our mate. And as I think about Alzheimer's and I guess how it's a disease that's sort of insidious, it just sort of comes in small doses so that you might not see a big change right away. One of the things that I guess people should think about as we're aging and is to, with that lens, look at the people that are getting up in age or even early onset, because I have a cousin who is very young and she has Alzheimer's. So the point is for us to be observant of those around us and conscious and patient.
But you have to make sure you're not indicting and embarrassing too, because sometimes you can say to somebody,
well, I wouldn't say it to someone. I'd just be observant, so that
you have to be respectful.
to go to a doctor, to take somebody to a doctor, to ask the right questions.
Supportive.
supportive.
Right.
Supportive. And I guess that's delivery and tone.
Yes, it
but
is.
sometimes you need help with that too.
Right.
You
and
might be
really-
a direct individual and you're like, you're okay in there?
Right, you
about
want to
being
be
conscious.
as non-judgmental
Right.
and invite a question and a conversation, and recognize that you're not a doctor. You're not going to be diagnosing. It's going to take the doctor
they'll say,
a
"What
while
about you?"
to diagnose what's going on and have some
Or self-denial. There's
Exactly.
some people who will deny.
Well, there's a whole lot of
There's a
denial.
whole
Meaning you
denial.
face a lot with,
Yes,
this, with the brain, so to
right,
speak.
the moment you say that.
But when we have conversations like this, it sort of makes it more normal to talk about it. And for a long time, people
Because it
didn't
sounds like
talk
mental
about
health,
Alzheimer's.
And then it's like,
It
what, are you
is.
trying to say I'm crazy now? I mean, it gets it can go into places you don't want it to go, depending upon who it is you're addressing.
Well, so I think the important point is there's still a lot of stigma about this
Absolutely.
disease. And if people can just come and say, look, I'm noticing something, I don't know what it is. And that's the important point, because you don't know what it is, because these symptoms could be lots of different things. I mentioned those 100 different types of dementia. There are things that can mimic those symptoms that are not dementia, that are in fact reversible. So you can have
So we can't
depression.
diagnose, right.
Exactly.
Right.
You
We
can have
can't deny it,
depression
right.
that has many of the similar symptoms, but
But it's depression, it's not Alzheimer's.
right. And
Yes.
if you
Poor
got
diet.
medications, those symptoms would disappear. So it's really important that somebody goes to a doctor, gets the right diagnosis, and matches the treatment to what is actually causing
What
the
a
symptoms.
great place to end. And at the top of the show, I think I said it was 4.5 million, and it's 5.7 million people that have the disease currently. But thank you, Dr. Tavares. You are an expert, and you communicated this information so well.
Thank you so much.
Thank you so much, and thank you, Savvy Panel. And we will see you next time on Brooklyn Savvy.